Well, welcome to the 10-minute business tip on mynewsroom.ca. Paul Martin here, as always. Joining me today, Dan Florizone, who is executive in residence at the University of Saskatchewan. That's kind of an arm or an extension of the public policy school, and is formerly a deputy minister within the province. And he was the guy who was deputy minister at health and kind of led the way for bringing in the lean program. Now, some years later, that got to be a bit of a controversial item, but in the original days, it was about streamlining the way we delivered health system, the health system and health services in the province. And there were actually some really serious home runs hit on that one. And one of those home runs we're going to start to talk about again, because it was around vaccines and vaccinations and the handling of vaccines. Back then it was H1N1, but now it's COVID. And so we're going to be talking about this. And I thought, what an opportune time to go back and revisit what we learned 10 years ago. So Dan, thanks very much for stepping in and for talking to us about this. And I do want to go back to those days. I mean, the Vaccine Center was one of the, I guess, pilots that you did for a lean project. And it was an absolute spectacular home run in terms of what you were able to achieve, or the department was able to achieve in those days. You want to just kind of recount that for us and what it was like?
Absolutely. So first of all, thank you, Paul. Great to see and hear your voice. This is a real privilege. So I want to thank you for this.
Oh, thank you.
Lots of memories come back when we think of COVID-19 and the parallel, which was H1N1. Now, as it turns out, H1N1 was less of a pandemic, even though it was declared as one. But at the time, as we were in it, we saw some real serious issues that were emerging. If you'll recall, H1N1 was really affecting a young population. First Nations, young children, pregnant women, young adults. And it was fascinating in terms of how to deal with, in that case, a variant of the flu, an influenza, that was really not your traditional influenza that attacked the older, more frail, the elderly. That's not to say it didn't at all, but primarily it was affecting a much younger population. So it was happenstance that we started with vaccination. In fact, we started with vaccines and a look through our lean lens at vaccines before H1N1 hit. Yeah. It happened to be an inventory that had problems. And the problems were largely that the province was buying vaccines and then shipping them out to be housed in health centers, hospitals, clinics. And that was delivered at no cost, no direct cost to those that were storing and administering the vaccine. So government pays, and the actual managers of the small inventories that were scattered across Saskatchewan weren't paying. So when there was a problem, an interruption, for instance, a cold chain break, or vaccine where a fridge went down and the vaccine had to be disposed of, it was thrown away, obviously properly, but disposed of. And government was footing the bill. And as soon as we started to take a look at what we were delivering versus what was being delivered into the arms, literally, of clients and the population, we were losing about 1.2 million a year in cold chain breaks and those interruptions. So it was a first low-hanging fruit. When we looked at it, we thought we've got to get this inventory straightened out, and we've got to take a look at the principles around how we deliver a vaccine that is fresh, that is high quality, and that is timely, that fulfills the needs of the population. So all of a sudden, Paul, enter in H1N1, and you'll remember these days well. We chatted. I want to thank you because a lot of the inspiring kind of conversations that I had around lean, we were able to bounce some ideas off of each other. The primary was that we needed to, once the vaccine was developed, figure out a way to get that vaccine into the arms of patients. We didn't have sufficient supply of H1N1 vaccine to open it up to everyone. As we know, the most efficient way of delivering any service is first in, first out. Unfortunately, when you're constrained in supply, it's a matter of prioritization. The benefit we had with H1N1 is we put out a call, not only for healthcare providers being at the front of that line, but for women, and particularly pregnant women and children. And there's something about the resonance of that message that allowed us to move forward. Of course, First Nations and our Métis population were highly susceptible to H1N1. And what we did, which I think was a very important move, was we opened up our antivirals and our vaccination programs to all, irrespective of jurisdiction. Treat them, provide the service, provide the injection, worry about the bureaucratic steps later. And that served us very, very well.
You know, and I think back to, I was writing stories about this, of course, and what struck me, and maybe I looked at it through the business lens as opposed to you know, more of a political bent to it, but I went into the vaccine handling facility. I was in the basement of the TC Douglas building, and it struck me, first of all, it's probably the most expensive warehouse space in the history of the universe. And you know, I didn't see the before time, I just saw after, but the before pictures that your team at the time showed me was stacks of boxes of vaccines right to the roof. It looked like a hoarder's facility, and you'd kind of go through the maze of boxes. And when I got there, after the lean process had been put in place, one pallet in the center of this big room, and the fridge where the cold storage stuff was. And it was just a remarkable transformation of how they were able to streamline from pharmaceutical manufacturer to clinic by taking steps out of the way, getting, for example, government services out of the picture. They were getting a delivery of it. And you know, there were so many steps along the way where always something could go sideways. That when H1N1 came along, we were able to distribute the vaccine to the population of Saskatchewan like in record time compared to any other jurisdiction in the country.
We were very proud, and in fact, the team was outstanding. We were backed up, of course, by on-the-ground public health teams that really did the bulk of the work, which was to take what was being delivered to them in real time and to be able to provide it into the arms of patients. Now, what was really interesting about that is we never knew day to day, week to week, what was coming in. So you can imagine trying to ready a workforce of public health staff, nurses. In this case, we also had others delivering the vaccine. We didn't have the privilege of having pharmacists, but we did have, for instance, cancer agency nurses who were vaccinating their clients. So what we did was we tried to figure out some early warning signals to be able to ready the workforce in advance of knowing for certain that we were going to receive a delivery. Health Canada had to inspect every lot, every batch, and would release it only after their due diligence. So how do you, when you're sitting in Saskatchewan in an office in Regina, decide whether Health Canada is going to today release a batch of vaccine? And I got to share something with you, a bit of a behind the scenes story. And that is, I informally talked to the CEO of the vaccine shop, the one central location. And I said, I'm not going to hold you to anything. I promise. All I want to know is, how you doing today? How are things going? What do you think? And we were able to use that intelligence, much like what you do in business, that kind of intelligence, to be able to inform and instruct whether we were going to be short or whether we'd have a bolus of vaccine. Mm-hmm. We're able to, on the weekend that Alberta opened up to its entire population, and by that late Saturday, early Sunday, ran out of vaccine, we were able to hold off, prioritize, and then open up literally within 24 hours to be able to get that delivery into the arms of patients. So a lot of it is logistics, but some of it, I got to say, is about relationships.
And having a system that can handle it. I mean, what was it, 6 weeks to do Saskatchewan, somewhere in that neighborhood? If that's, and I'm going from memory here, but yeah, something like that. It was like 2 years for Ontario. I mean, those like, those are staggeringly different numbers. And as we head into the vaccine for COVID, I mean, we should probably be thankful in this province that we're going to be able to handle this thing. We do it the same way.
So let's, we know we have the teams, the technology, the systems to be able to deliver a vaccine. The supply, I believe, will be the greater constraint, not our ability to deliver. And that puts this province in a very good stead.
Well, listen, the 10 minutes has evaporated on us. I want to thank you for stopping by and taking the time to do this today. And maybe it's a bit of a walk down memory lane, but it's one that we need to remind ourselves of, that we've got some reason to smile here, and that there is some sense of optimism that comes with it, because some of the work we did before will serve us well tomorrow. Dan Florizone, thank you very much for taking the time to join us.
Thank you, Paul. Anytime.
Take care.
Bye-bye.